Well, hello, it's Bruce Williams again, and today is time for Growth Path Challenge number 46. The slides from this particular test, which is going to be given in the short answer format, were first seen at the 2006 Descriptive Veterinary Pathology course on the grounds of the Armed Forces Institute of Pathology in Washington, D.C. So with that, let's go ahead and get out our pens, our papers, and let's begin. Slide number 1 is tissue from a horse. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. We're looking at a cross-section of a spinal cord, which has probably been at least partially fixed. You can see the outline of the gray matter with the dorsal horns, the ventral median fissure right here. And in this quadrant, we have multifocal to coalescing necrohemorrhagic leukomyelitis. If you want to say hemorrhage and necrosis of the white matter tracts of the spinal cord, that's fine too. Remember, this is hemorrhage. Whenever we see hemorrhage, we want to think about necrosis. I generally try to break down the diseases of the spinal cord in horses as those that hit the white matter, those that hit the gray matter, or those that might hit both. One lesion that should be top of your list for white matter, because it almost exclusively hits the white matter in the horse, is equine herpes virus, which causes hemorrhagic lesions around vessels and vasculitis. And unfortunately, if you look for herpes viral inclusions, like you see in so many other herpes viral diseases, you just almost never find them. But the key is that it's pretty much exclusive to the white matter of the horse. Okay, that's the one that's exclusive to the white matter. There's a couple that really like to hit the gray matter. This isn't what these are, but those would probably include rabies, and the flaviviruses like West Nile virus and Murray Valley virus and Kurgan virus and some other lesser seen ones. And those really like gray matter. You can also get ischemic and hemorrhagic disease of the gray matter in animals that have sort of a traumatic spinal cord injury or have been on their back for a long time and they're slow to get up from anesthesia. That usually tracks the gray matter. And then there are a couple of others that can hit both, and the one that I like and I would include in this would be Sarcocystis neurona. You can see necrotizing lesions both in the white matter and the gray matter. Sort of rarity might be a verminous myelitis like you might see with Paralaphus strongylus, which is just going to go wandering wherever it wants. But I certainly ask you for 2. I think the best 2 for this one would be equine herpes virus type 1 and Sarcocystis neurona, the causative agent of equine protozoal myelitis. Okay, ready to move on to the second one? Slide number 2 is also from a horse, and I would like a morphologic diagnosis for this. Okay, time's up. This one is a little tricky. We used to sing these much worse, but we have, here is the squamous portion of the horse stomach, the glandular portion of the horse stomach, and then we have this big extension of what appears to be squamous epithelium. Don't see any ulcers here. There may be a couple, but what we're looking at here is a small gastric squamous cell carcinoma. I don't know anything else that would replace part of the pars glandularis with a large area lined by squamous epithelium. These usually look much, much worse. They are neoplasms that can metastasize. They often will explant widely in later stages in the animal's body. They will cause hypercalcemia in horses. And this was a bit of a tough one. The other thing that will pop up right here along the margo plicatus, or the part that separates just this wrinkle where the squamous and the glandular portion of the stomach come together, are Granuloma is caused by Drachia megastoma. That is a parasite that is transmitted by flies, and it gets into the animal's oral cavity. It's swollen. It causes large granulomas or brood patches, right? The Margot plicatus. But this one doesn't look swollen. There's no hole in the middle, which is how the females will pass their eggs into the GI content for eventual passage out of the animal. So squamous cell carcinoma. If you got that one, you're doing pretty good. Okay, slide number 3 is tissue from a sheep. What I would like for you to do is name the agent and give 2 other possible lesions. Okay, time's up. This is a classic picture. Now it's in all the textbooks. And what we're looking at is we're looking at the heart, and we're looking at the opened pulmonary artery. At the base of the pulmonary artery, we have these multifocal hemorrhages. This is a classic lesion of blue tongue, which is caused by an ovine orbivirus. A very similar virus also causes epizootic hemorrhagic disease in deer, which looks almost identical. Okay, so we're looking at blue tongue. Morphologic diagnosis, which I didn't ask for, that would be multifocal coalescing pulmonary artery hemorrhage. And I asked for 2 other possible lesions. So you want to know a little bit about blue tongue. Orbiviruses are endothelial viruses, so you can really have hemorrhages anywhere. So that would be one, hemorrhages in multiple organs. Another one would be cyanosis of the dental pad or tongue, often due to venous infarction. That's where the disease gets its name of blue tongue. So cyanosis for dental pad or tongue. Another place that you will often see lesions is you'll see a necrohemorrhagic coronitis, or inflammation of the coronary band. Those are classic lesions that you will see with blue tongue in sheep. In cattle, especially foals, you can see severe severe lesions of the neural system if it infects the animal during the proper window during gestation, where the brain is forming. If it infects the external germinal layer, you can see porencephaly, hydranencephaly, and other massive defects. And a recent outbreak in the last 10 years in Europe infected calves in utero, and thought it was going to be really disastrous for the beef industry in Europe. Luckily, that did not come to pass. Here's one where real life may interfere with your diagnosis. This is a classic lesion, the pulmonary artery hemorrhages in blue tongue. But in real life, every time you see that, you don't have to go crazy and say, I got blue tongue, which is a reportable disease, because you can see a very similar lesion with enterotoxemia in sheep. That is a disease caused by Clostridial perfringens type D, and it starts out with an enteritis, and then the epsilon toxin gets into the bloodstream, and it causes hemorrhages throughout the body as well. And you can see hemorrhages in the pulmonary artery or the aorta or the great artery. So not every case that looks like this is going to turn out to be blue tongue. But if I'm taking a certification examination, I'm writing blue tongue for this very classic lesion that's in all of the textbooks. Okay. Slide number 4 is tissue from a pig. Can you give me a morphologic diagnosis and the cause of this lesion? Okay, time's up. Pigs get a lot of diseases in their lungs, and nowadays when you see pneumonia in a pig, you're probably going to isolate 1 or 2 different viruses and a couple of bacteria, and it's often a mixed bag. But the one thing that really causes the worst lesions, causes large areas of hemorrhage and infarction in pig's lungs, which causes the worst lesions that you can see in a pig's lung. When you see something that's terrible, you want to think about Actinobacillus pleuropneumonia. Large areas, what used to be called red hepatization, but it's consolidated, very inflamed areas of lung with extensive fibrin and hemorrhage. You can see in here we have distension of the interlobular septa, probably with a lot of edema fluid and fibrin. And when I see these big, angry, hemorrhagic areas in pig lungs, I'm going to go with Actinobacillus pleuropneumonia. Actinobacillus suis can occasionally cause similar lesions, but pleuropneumonia is the bad actor in that family. And probably this was predisposed by some viral disease. Animal might have mycoplasma on top of it, but nothing makes pig lungs look as bad as Actinobacillus pleuropneumonia. Okay, slide number 5. And I remember this slide from when I was a resident in those Wednesday slide conference. And it's a great slide. This is tissue from a leopard frog. Leopard frogs are ones that you used to dissect in high school. I don't think they allow people to do that anymore. I think it's all done on computers. But you used to get a leopard frog and you used to dissect it when you were in the 9th grade. And for this leopard frog, I would like you to give me a morphologic diagnosis, an etiologic diagnosis. We're going to trot that old format out. And how about a cause? Okay, time's up. The morphologic diagnosis. This is a renal adenocarcinoma. Some people call it the renal adenocarcinoma of Luque. That's Lucke. It was named, I guess, after the veterinarian pathologist who first worked out the pathogenesis of this particular lesion. The etiologic diagnosis. This is caused by a herpes virus. So the agent would be rannid herpes virus type 1. Well known. This is one of the gamma herpes viruses. It causes neoplasia. It's not your typical alpha herpes virus, but this is rannid herpes virus type 1. It causes renal carcinoma. It has a pretty cool life cycle. During the summertime, the tumor cells grow and reproduce. They don't produce any virus, but they grow exponentially, and the tumor continues to grow. As fall comes along, it starts to produce virus. The tumor no longer grows, but all the cells within it produce virus because that frog, before it goes into hibernation or dies over the winter, it's going to take its last pee of the season into a puddle. Okay, and it's going to contaminate that puddle with all of these herpes viruses. And then it's going to lay eggs. And in the summertime or in the springtime, when those eggs hatch out and we have the tadpoles, they will all become infected with that herpes virus. And then farther down into their lifetime, the cycle begins again with the production of the tumor, which ultimately will become productive as far as virus. But when the tumor's growing, the viruses are not. When the viruses are reproducing, the tumor is not. It's a cool life cycle that we see with renal adenocarcinoma of Luque. Okay, slide number 6 is tissue from a goat. Okay, I would like you to give me 2 possible agents in this case. That's it. 2 agents. Okay, time's up. One's very just jumping out at you. You couldn't ask for a better representation of Homunculus contortus. This is known as the barber pole worm, and we're looking at the females, and they have this red stripe that goes around. If you look closely at these, what you are seeing is the white stripe is a long uterus with eggs. The red stripe is a long GI tract with blood. This animal is probably very anemic. And these are blood-sucking strongyles. So these animals usually have hypoproteinemia. They may have swelling underneath their jaw along the ventrum, which is known as bottle jaw. They are usually very anemic. It's not uncommon, at least in this part of the country, because people think that goats seem to be able to forage on just about anything. They don't worm them as they should because it's probably cheaper to get a goat than it is a good dose of warmer. So we see a tremendous amount of this. Sometimes you will see animals with no parasites that are still bled out. And you know that somewhere along the line the animal had a severe case of parasitism. And make sure when you do autopsies on these that you always send feces off to the parasitologist and get an egg count on homuncus, because sometimes you'll find large numbers of eggs but no visible worms, and I figure I probably missed it somewhere along the line. The other one that you can't see but we're going to infer because of the presence of this gastric mucosal hypertrophy, this sort of lumpy, bumpy, some people call it a Moroccan leather appearance. There is proliferation of the gastric mucosa. Not a lot of inflammation, but proliferation. Not something that you get with homuncus, but you will get with the small trichostrongyles. They're too small to see, or maybe if you got really, really close and your eyes are really good, you would see them. And those are the ones that belong to Ostertagia in sheep and goats. It's Ostertagia circumcincta. It's Ostertagia in cattle. Ostertagia trifurcata is also one that you will see in sheep and goats. So this animal had tremendous parasitism going on. I bet when it went to autopsy, didn't have an ounce of fat on it, and it was white as a sheet, as they usually are. Slide number 7 is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up. This is a classic, but it's just a huge case of ventricular cholesteatoma. Let's make sure that we put the location, even though I don't know at other places that horses will get cholesteatomas. And the cause of this is not really well known. It's seen in older horses. Usually they're small. They're always in the ventricle. It is the result of chronic hemorrhage. What starts it off, probably starts off in the choroid plexus, but just chronic hemorrhage, and then the release of blood pigments and other proteins cause a granuloma. And cholesterol will cause granuloma formation. And this is a huge granuloma, which is composed of small granulomas. And all of them will have these clear spicules of cholesterol, and you'll see blood pigments in them as well. You rarely see them get this big. This horse may have shown, and most of them are incidental findings in necropsy. This animal, because of what appears to be hydrocephalus, probably had some significant neurologic defects, because I don't see how CSF's going to get around these huge cholesterol granulomas. Some people call them cholesterol granulomas, some people call them cholesteatomas, some people call them cholesterinic granulomas. I think any of those are okay. Don't confuse it with the cholesteatomas that are seen in people, and those are also seen in hamsters. And those are granulomas which have a lot of cholesterol in them, but they arise from the squamous lining of the very inner part of the horizontal ear canal, as well as the outer surface of the eardrum. And they can get big, and they can puncture that eardrum and damage the bones within the middle ear or the tympanic bulla when they get really big. So that's another form of cholesteatoma, has nothing to do with this. And then one more little fact about cholesteatomas. The other animal species you can see this form in ventricles are bears. And I don't know what bears and horses have to do with each other, but you can also see cholesterol granulomas or cholesteatomas in the ventricles of bears. Slide number 8 is from a pig, and I would like for you to name the condition and a likely cause. Okay, time's up. The name of the condition is bullnose. It's bullnose. The likely cause is Fusobacterium necrophorum. We see necrotizing lesions in a number of species in the oral cavity with Fusobacterium necrophorum. It's a common commensal. It's always in there somewhere. And the pathogenesis of this in pigs is generally clipping the milk teeth, which is usually done in the first day of birth. The milk teeth are very sharp little teeth, and they will cause scarification and pain on suckling, and so they're often clipped. And if you clip them too short, then you will get invasion of the oral cavity, the lining of the oral cavity by Fusobacterium necrophorum, and eventually you get a stinky lesion that is tremendous amounts of granulation tissue, and it causes deformation of the oral cavity and often of the turbinate bones of the pig. You're not going to mistake this for atrophic rhinitis, which in itself may cause deviation of the snout or a wrinkling effect. This is very proliferative, very nasty looking and nasty smelling. Bull nose in pigs. Slide number 9 is tissue from a cat. Can you name the condition and give me a likely breed? Okay, time's up. Not an uncommon condition in a certain breed of cat, and that's Persians. And this is a polycystic kidney with variably sized cysts throughout the kidney. And one of the keys to this is, beyond the cysts, is the absolute yellow-white characteristics of the what's left of the cortex. Okay, that's because this cortex is pretty much what you're seeing the big cysts. You're not seeing the small cysts, but all these cysts are surrounded by fibrous connective tissue. And essentially, by the time the animal gets to this point, at 1 to 2 years of age, the cortex has been replaced by scar tissue and inflammation. There's no functional cortex. The animal goes into chronic renal failure. This is a very common appearance. This fibrosis and multiple cysts and sort of a shriveled kidney is very common with the autosomal dominant forms. Persians are affected with both autosomal dominant and autosomal recessive. They get both types. The recessive tend to be much more severe at birth, and the animal is born with these 2 gigantic kidneys, which are nothing but cysts. There's absolutely almost nothing to filter urine and do the functions of the kidney at birth. The animals come out with big bellies, almost like they're pregnant, because those 2 kidneys are gigantic. And those are the autosomal recessive forms. The dominant forms, they tend to get them from one parent. They take a longer time for the animal to die than the recessive forms when they're getting it from both parents. Okay, finally, slide number 10. Hey, let's start the weekend off on a great note, give you sort of an easier one. Hopefully that you will get this as a great, great old picture from the 1950s, taken at the AFIP. This is tissue from a turkey. Can you give me a morphologic diagnosis, a cause, and another affected organ? Okay, time's up. Hey, this is an absolutely great case of histomoniasis or Histomonas meleagritis. The morphologic diagnosis is multifocal to coalescing necrotizing hepatitis. Nothing else gives you this pattern in the liver of a turkey. Now we see it a lot in chickens, especially broilers. It's a classic disease of turkeys. And the name of the disease is blackhead. Sometimes with overwhelming infections, the animals will die very quickly. They'll become cyanotic. Their heads will swell. That's why it's called blackhead. Okay, not every animal. A lot of animals will survive for a while, so you may see granuloma formation and the presence of the trophozoites both in areas of necrosis and in areas of granulomatous inflammation, sometimes intracellular within big multinucleated giant cells. The other organ that I am looking for is the cecum. It causes a necrotizing typhlitis. I had an absolutely great case of it yesterday. I walked into the autopsy room and one of our brand new residents was cutting in tissue from a turkey, and I looked at it and I said, another case of blackhead, because great lesions in the liver. The ceca were really big. The walls were very thick. He looked at me like I was some sort of pathology god, because I've been doing this for 30 years and he'd been doing it for about 3 days. But it's an easy diagnosis in avian species. It's seen in a wide range of bird species, peahens and peacocks, and just about any type of poultry or game bird can get Histomonas meleagritis. It is spread by the cecal worm Heterachus gallinarum, although occasionally you can see it, just regular old roundworms. But a great lesion in poultry, and one that you absolutely won't mistake for anything else. Well, that's it for this Growth Path Challenge. I hope you had a good time listening to me as I did talking to y'all. And please come back next week. We're going to have another Growth Path Challenge. And I'm hoping everybody has a fantastic weekend, that the weather's going to be good, and that you're all enjoying it in good health. And I will see you next time.